day, everyone. We are the Group 3, and our report is all about selecting and using protective equipment, sports equipment emergency, situations and injury assessment, bloodborne pathogens, and universal. And our objectives discuss the legal concerns related to the use of protective equipment, identify the different types of protective equipment available for various parts of the body, identify the different bloodborne pathogens, understand the high-risk contact and collision in sports, selection and using protective equipment. Injuries are common in sports because of the nature of the action. Injury can be caused by a variety of circumstances, both individually and collectively. Protective equipment selection, fitting, and maintenance are unquestionably important in injury prevention. As a result, understanding many forms of protective equipment available for a given activity, as well as how that equipment should be fitted and maintained to decrease the risk of sports injury. This is especially important in contact sports like football, hockey, and lacrosse, but it can also help in direct sports like basketball and soccer. Protective sports equipment is chosen and acquired with the goal of ensuring the health and safety of athletes. When protection from repeated impacts is necessary, very robust materials are utilized. Now we are going to discuss the head protection. First, football helmet. Before using a helmet, the athletes should examine it as follows. Check for correct installation and degradation of foam padding. Cracks should be investigated. Make sure there haven't been any changes made. In air-padded helmets, check for inflation. Make sure everything is secure. In contrast to football helmets, ice hockey helmets must only sustain a single hit. In addition, the helmet should protect the head against low mass, high velocity impact forces such as being hit with a stick or puck, like fall. And lastly, baseball helmet should absorb high velocity impacts. Ability to prevent head injury is questionable. That's why the baseball player is wearing helmet because there is tendency that the pitcher is mistakenly throw the ball to his head or her head. As you can see, there are three types of helmet. The blue one is football helmet, and the white helmet is ice hockey helmet, and the third helmet, which wearing by a kid, is baseball helmet. The second one, face protection, face guards. The primary goal is to guard against projectiles, transported items, and player impacts. Without a face visor, junior hockey players were 4.7 times more likely to have eye and facial injuries. The NCAA requires the goalkeeper to wear both throat and face protection. Helmets and face masks that meet the NOCSAI standard are required in men's lacrosse. Chin straps. The single strap allows for some helmet rotation, but it is generally sufficient for keeping the helmet in place on the top of the head. Cycling and kayaking are two activities that use it. 4-point chip straps fastened by either the high hook up or the low hook up in sports such as football and lacrosse. So these are the face protection. As you can see, the football player is wearing a helmet and he is using a 4-chin strap connected to the high and low of the helmet. And the second one is face shield. This will help the players to prevent herself getting hit by a small debris to her face. And the third one is the bike cycling helmet or kayaking helmet. The third one is eye and ear protection. Eye protection, there is a variety of clear as well as tinted sunglasses and goggles for nearly every sport. According to the American Academy of Ophthalmology, more than 90% of all sports-related eye injuries can be prevented with the use of appropriate protective eyewear. Ice hockey, men's and women's lacrosse, baseball, basketball, squash, and handball all require special safeguards. Sports eye protector, class 1, consists of a molded single unit lens, and frame. Class 2 consists of a lens placed in a separate frame, and Class 3 consists of protection with no lens that is worn alone or over spectacles. Eye protection. Cauliflower ear. Hematoma in the outer ear might arise if the proper equipment is not used. Due to high frequency of ear damage in sports like boxing, wrestling, and water polo, air protection is essential. So these are the examples of eye and air protection. As you can see, the wrestler is using his air protection because he don't want to get injured to his ear. And the second one is the eye protection or sunglasses. They are using this because they want to protect their eyes from hitting by small objects.
So my name is Liam Kanensha. To those mentioned by Avis earlier, also part of the sports equipment emergency. So by the way, what is sports equipment emergency? So the sports safety equipment and gear may sometimes look unfashionable, but using the right protecting safety gear for your sport is essential for preventing serious injury or reducing severity of an injury you may receive. I will continue the remaining equipment. Mouth guard should be considered mandatory safety equipment during sports that have any risk of injury to those face, jaw, and mouth. The most effective mouth guard fit well and are comfortable, but they also stay in place, are durable, easy to clean, and don't restrict speaking and breathing. If you play certain contact sports such as football and hockey, protective parts are required, but you should wear pads for any contact sports. The type and the style of pad seems endless and includes shin, knee, elbow, wrist, chest, neck, shoulder, hip, and thigh pads. Some sports such as inline skating and skateboarding include wrist, knee, and elbow guards as standard equipment. These hard plastic guards prevent cuts, scrape, and abrasion and reduce the major strain, and or even the fracture after a hard fall. Sports cleats are important during field sports such as football, baseball, and soccer. The right running shoes can decrease your risk of overuse injury. Special cycling shoes can reduce foot pain and increase your pedaling efficiency. Court shoes with support and good traction are designed especially for baseball and tennis.
Let's now proceed to the situations and injury assessment bloodborne pathogens. But first, let's define what is bloodborne pathogens is. So bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include hepatitis B virus or HBV, hepatitis C virus or HCV, and human immunodeficiency virus or HIV. So, the differences of HBV, HCV, and HIV. First, hepatitis B virus, also known as HBV, is inflammation of the liver once thought to be passed only through blood products. It is now known that hepatitis B can also be transmitted via needle sticks, body piercing, and tattooing using unsterilized instruments, the dialysis process, sexual and even less intimate close contact, and childbirth. Hepatitis C virus, on the other hand, is a blood-borne virus, and most infection occur through exposure to blood from unsafe injection practices, unsafe healthcare, unscreened blood transfusions, injection drug use, and sexual practices that lead to exposure to blood. And lastly is the human immunodeficiency virus or HIV, which is a viral infection that progressively destroys certain white blood cells. HIV is transmitted through close contact with a body fluid that contains the virus or cells infected with the virus, such as blood, semen, or vaginal fluids. So these are the exposure incidents. First, skin pierced, cut, or scratched by a sharp object contaminated with blood or other potentially infectious body fluid. And second, spills or splashes of blood or other potentially infectious material onto non-intact skin, such as cuts, hangnails, abrasions, shaved skins, or any mucous membrane. The high-risk contact and collision sports. Sporting activities can be a risk factor for the spread of infectious diseases. The close contact in some sports can allow infections to spread by direct skin-to-skin contact, inhalation of infected droplets or aerosols, or injuries resulting in breaks to the skin which disrupt the body's natural defense mechanisms. These sports are referred to as high-risk contact and collision sports. Evidence to date suggests that the highest-risk sports are full-contact martial arts, boxing, and wrestling. For example is rugby. The degree of close contact increases as the player becomes more experienced and participates at a higher level of play or competition. Terminology can vary and the definitions applied in these guidelines are as follows. Number 1 is high-risk contact or collision sports. Examples are rugby, full contact martial arts, boxing, wrestling, Gaelic football, or hurling. And number 2 is medium to high-risk contacts. Examples are soccer, basketball, and hockey. And number 3 is limited contact. Examples are squash, volleyball, and gymnastics. And number 4 is non-contact. Examples are running, dancing, aerobics, swimming, tennis, and weightlifting. Infections in contact sports can be spread by first, person-to-person contact like skin contact. Number 2 is a common source like contaminated equipment or facilities or soil. And lastly, airborne or droplet spread such as mumps, glandular fever, and influenza. So these are the precautions of blood-borne pathogens. First, athletes, teachers, and coaches involved in contact sports should be educated on the risk of blood-borne virus. Number 2 is the BBV transmissions, how to deal adequately with bleeding injuries, and how to prevent infection if there are any skin abrasions or lesions. 3. Any athlete with a bleeding injury should be removed immediately from the field of play. 4. Bleeding injury should be promptly treated and standard precautions applied like hand hygiene, gloves, blood-stained clothing should be removed and placed in a plastic bag for appropriate laundering. 5th, any equipment contaminated with blood should be cleaned thoroughly first, then disinfect with a 1000 ppm bleach preparation and dried appropriately. And lastly is those administering first aid should be appropriately trained.
Thank you for listening.